All right. So for the next condition that we'll be looking at the Sydenham's chorea. Sydenham's chorea is also known as what? Saint Vitus dance. And this disease actually got its name from the way the person will be moving their body. Okay, it's like a dance, but it's not a dance. It's actually a complication of the disease condition. All right. So we get to look at this Sydenham's chorea from the causes, from the definition, the causes, the symptoms, the diagnosis, the treatment, and prognosis. All right. So from the definition, we say that this Sydenham's chorea is also known as what? Rheumatic chorea or Saint Vitus dance. Okay, so it's a neurological disorder that typically occurs in children, and this is usually as a result of they actually got infected from a group A beta-hemolytic streptococcus. All right, so the same bacteria that can cause what? Strep throat or a rheumatic fever. The first time they actually even taught us about this Sydenham's chorea was when they were teaching us about rheumatic fever. All right, so it could be as a complication. All right, so infection from beta-hemolytic streptococcus led to what? This complication known as what? Sydenham's chorea. Okay, so what are the causes? It's infection. So the disorder is triggered by what? An abnormal immune response to a streptococcal infection. The autoimmune reaction, the immune system mistakenly attacks brain tissues, particularly the basal ganglia, which control the movement of the person. All right, so the person is just moving, there's no control. Can you see the way this guy hand is? There's the way they've been moving, and now they call it what? A Saint Vitus dance. Okay, so symptoms, there'll be chorea. Chorea is basically rapid, uncoordinated jerking movement. Primarily, these movements will affect the face, the hands, and the feet. Okay, emotional lability. This is just sudden mood swings, inappropriate emotional responses. Okay, then speech and motor impersistence. There's difficulty speaking clearly, and there's difficulties maintaining a tongue protrusion. Okay, motor impairment. There's loss of fine motor control. So their handwriting skills and walking will be affected. Hypotonia, there's low muscle tone, right? Which may become more apparent after treatment. Okay. Diagnosis, you can do a medical history, which is review of symptoms and recent infections. Physical examination, of course, you are looking at the signs of the St. Vitus dance, okay? We are observing for what? Chorea and other neurological signs. Laboratory tests, you can now do blood tests just to dictate any recent streptococcal infection. The imaging studies, you are doing things like what? MRI or CT scans. This one is to rule out other causes of chorea, okay? So treatment, bed rest. This one is for mild cases. So you just make the person rest, and this can help to reduce symptoms, okay? Medications. So medications like what? Anticonvulsants, antipsychotics, antibiotics, all these medications can help to manage the symptoms and prevent reoccurrence of this, okay? Supportive care, this one you are doing physical or occupational or therapy just to improve what? Motor skills and daily function, right? Prognosis, for recovery, most children will recover completely within a few weeks or months. Okay. Reoccurrence, some children may experience a reoccurrence. Okay, especially if they have another streptococcal infection. Okay, so after treating this, you basically prevent any possible streptococcal infection that will ever come up. All right, so that's it for the Sydenham's chorea, also known as rheumatic chorea or the Saint Vitus dance.